And 2020 just seemed to be like something many of us in healthcare, we just don't want to. It's kind of like, I don't want to remember that time. It was too scary, too leery, too unimaginable.
Welcome to the Zami Nobla National Organization of Black Lesbians on Aging podcast. We are your sound source for Black lesbian herstory. I'm your host, Angela Denise Davis. Today, our conversation is about how we keep it all together in a time when it seems like things are falling all apart. We speak with Sherri Jackson, a respiratory therapist who lives in Chicago, Illinois. She sheds some light on some very heavy subjects as we talk about the COVID-19 pandemic and changes in healthcare.
My name is Sherri Jackson. Everyone knows me as Sherri. How do I show up in the world? I show up in the world by serving the people. I work in healthcare, been in healthcare for 30 some odd years. How else do I show up in the world? Just trying to be a good person. And at one point in time, I had a garden when I owned my home, and I showed up in the world by putting my hands in the soil and the dirt and just being with nature.
Well, we are so glad that you have shown up today as part of the Zami Nobla podcast with your very generous and gracious soul. Thank you so much.
You're welcome.
I had the pleasure of having lunch with you a couple of weeks ago, and it was just very evident that we needed to have you on the podcast for our listening audience to hear your story and for us to get a sense of where we are today in the world, especially around the COVID pandemic and healthcare, also to get a slice of how the LGBT community is doing in Chicago and some of the herstory there. I know you grew up in Rockford, Illinois, so you were a true Midwesterner, as am I. And I'm curious about your vocational rivers, and tell us a little bit about the work that you do and are doing in healthcare and this other interesting stream of ministry.
I've been in healthcare, Angela, for over 30 years. Started out very young as a licensed respiratory practitioner and then also nursing. And then decided to accept my calling in ministry and went off to Virginia. 2004, I went to Richmond, Virginia to study at Virginia Union University, the Samuel DeWitt Proctor School of Theology. For me, it was something I felt that I needed to do, accept the calling as a Black woman, as a lesbian that's a Black woman, and sort of combine those two things together and just give back to the universe, if I may.
I want to get back to the ministry work that you've done and are doing, but I'm curious about how you became interested in respiratory therapy and what led you down that path.
Oh, wow. Actually, I was born with a certain congenital heart problem. And so as I got older, I was always told that I was like this miracle child, considering the time that I had my surgery. It was in the 1960s. Of course, we didn't have the technology back then. We didn't have a lot of things, but my parents were directed by a physician in Rockford at the time who was Black and very, very popular and respected. And he connected my parents with physicians in Chicago. And those physicians helped save my life. And I decided when I got older, I was going to give back and save others' lives the way my life was saved.
What about the call to ministry? How did that show up in your life?
Oh, that showed up through personal life experiences. don't know. I felt that I was on a road of really needing something to, I guess, really help in my life. I felt something was missing. And I had been away from the church for a very long time, 14 years. I grew up in a very strict religious home. You know, if my father could keep us in church 24/7, he probably would have. My mother was the total opposite. She was sort of like that balance, like, yeah, okay, I believe in, you know, a higher power, but I also believe that you have the right to question,
Mm-hmm.
you know, the things that you're reading and all of that. And and so as I was getting older, and I think even as I was younger, I would hear things in the church and I would be like, okay, I don't know if I want to be a part of this. This just does not sound like something for me. You know, back then, God was like this really mean individual from the Old Testament. And I just didn't really care for that. So make a long story short, as I got older, away from the church, I just felt like, okay, I'm missing something. And through life experiences, I had a sister that died very young at 53. My dad followed like maybe 3 years later, he died. And I just thought, okay, I really am missing something in my life besides like going to work and doing all this community activism. It's great, but I'm really missing the spiritual component. So I visited a church, recommendation of one of my coworkers, and that was Trinity United Church of Christ. Probably back in 2004, 2005, visited, became very active, but had not joined the church yet for maybe 2 years after. And I was involved in their social justice ministry, their same gender loving ministry. I did a lot with women. I tutored youth. And then I got this calling into ministry, you know, that just sort of happened. I kept thinking there's more that I'm supposed to do and want to do for society, for myself, most importantly, the community, and ended up got accepted into Virginia Union University.
It's interesting because you were in that time, that era when we saw a lot of, especially older women returning to school to go to seminary or divinity school. And it's really interesting seeing that whole harvest of women who have made an impact in their local congregation and in theological education and religious life. I'm curious, though, having that strict religious upbringing and then coming back to the church, if there's ever a church to come back to, it would be Trinity in Chicago, because they just did and do so many wonderful things. But how did your strict religious upbringing affect your sense of who you were and your identity as a lesbian?
Oh, wow. Good question. It affected me a great deal. I just felt like even before I knew I was a lesbian, that I didn't belong in the church. I also felt women, we played an integral part, but we weren't good enough to be behind the pulpit or be a bigger entity as the men were. But I didn't believe that. I was like, no, that's not true. There's a bigger place for me, bigger place for other women. There's a bigger place for me as a lesbian, a same gender loving person, however one identifies. I felt, no, we are what makes the church up. And without us, there would be no church. So I was sort of a rebel rouser along my journey. Even in seminary, I was very out and very vocal. And even at Trinity, I played a very, very big part of doing programs and things that really impacted LBGT people, women. And I'm grateful for that journey. I really am very grateful.
When did you know that you were lesbian, and when did you come out?
Oh my gosh. Whew. I remember that I had this infatuation for women or just in general. And I was a little tomboy when I was younger. So I say around 10 years old, there was a music teacher and I thought, oh my God, she was just gorgeous. And I guess I had like this crush on her. And there were other women too, but I didn't really understand, like, okay. And then there would be people in the community surrounding me or that knew me would say, now, you know, you're not supposed to look at women that way, honey. You know that, right? You know.
So
And
they
other
were
people,
aware of you looking at women.
yes, yeah, but
Interesting.
I wasn't
Interesting.
really aware of that. So I came out probably when I was like 23 years old. And at the time, believe it or not, I had left Rockford and I was living in California, was with a guy at the time, a dear friend. And I thought, oh, okay, this is great, you know. But I never really felt like, oh, this is something I want to do my whole life, you know, be with this guy. I came out to him, and I was like, okay, I can be myself and be this individual. But it was at a time also that was in the 80s, and it was during the AIDS pandemic. You still had to be kind of quiet and closeted. You know, you didn't have the freedom, I would say, like you have now. But I'm grateful that during that time, I also had older people from the generations before me. I looked at them as like they made it possible for me to be the individual that I was then and the individual I am now.
Tell me a little bit about your history of LGBT activism in Chicago and what the landscape there is for Black queer folk.
Wow. I was very active in Chicago, like in the 90s, early 2000s. God, I was with so many organizations, Chicago Black, Lesbian, and Gays. I sat on the board of then the Horizons Community Services, which is now the big LBGT Center here in Chicago. Oh my God, there's so many. I was on the Lesbian Community Cancer Project, sat on their board. There's just a whole list of things that I was active in and did. But I was very, very active in the city and very active, I felt, at a time that really was a changing time, because it was during the time when the AIDS pandemic was still big. And I remember sitting at the bar sometimes, going to the bar, sitting with people that either served me or sat next to me at some of the LBGT bars, and then ended up taking care of them in hospitals during the AIDS epidemic.
Wow.
And it was something else, you know. And I tell people at work, because the young people I work with, you know, they're like in their 20s, 30s. They only know of the AIDS epidemic through what they've read or relatives they may have encountered, but they don't know it like, say, you and I know it. What they know is about the COVID-19 pandemic, but they really don't have that history. Even those that identify as same gender loving, they really don't have that history of the AIDS epidemic. And it's really kind of sad. And I think sometimes they think, oh, that was then, that's not happen. That won't happen now. You know, HIV won't happen. That was in your generation.
Right.
It's just really interesting.
How is the LGBT Black community doing now, particularly in the face of COVID? What's going on or not going on in Chicago?
That's really interesting. You know, now that I'm older, I don't want to say I'm not as active, but I think I'm more active now online than I was in person. Because it's kind of like, oh, the torch was passed on to other people. Now I'm sort of just to teach, give guidance. But it's very different. I don't know how it is in Atlanta, but it's very, very different. Things that may have impacted my life may not be of importance now. And COVID is a big thing for everyone. Mm-hmm. But I don't know necessarily, like, we talk online about it, but I really honestly don't know if the LBGT community is out there, say, in the forefront. You know, you hear about people and we talk about it online, but I don't know what we're really doing per se now in person. You know, everything has really changed to me. I don't know. I feel like sometimes I'm sort of lost. It's like, you know, do I really know what's going on in the community? Has that much changed? Are we just strictly online now? And a lot of the leaders, they've either retired somewhere or many of them have died. You know, the people that really made the difference. Or we've decided it's not our generation time. We're to teach and mold, but it's not necessarily for us to be out there in the forefront.
3:49 p.m.
But as far as COVID, again, we talk about it online, and this is what we should do, the moral, ethical things. But I don't know what people are really doing in the LBGT community as far as that goes.
I think you're right. I think COVID has changed so much in that so many of us now are living these virtual lives because we have to, because of the nature of what we're dealing with. I think that there's also something you've identified, this idea of as we grow older, sometimes we also grow outside of those congregations, social congregations that we once were very active in. And that always leads me to the next question I ask my guests when we come to that piece is, what have you come to know? What wisdom have you gained in your life as an older Black lesbian? How do you look at the world now on the cusp of 60? As opposed to, you know, when you were younger and maybe more active in the community?
Oh, wow. You know, sometimes I feel like my parents now. Mm-hmm. It's, and then with everything going on with COVID, the Trump era, when that was going on, I felt like I could hear my parents' voice, like, we're living in some scary times. And I just felt like, no, this isn't supposed to be happening. You know, this is what my parents and my ancestors fought for not to happen. Mm-hmm. And now I feel like I'm reliving a lot of those things. And then COVID, for me, being a healthcare provider, you know, we talked about it when I visited Atlanta. It's just like some scary times, even for me being in healthcare, because things are changing constantly. We just got a big email the other day, and I'm sure other facilities around different states have. And now they want us to take a booster shot, and now it's going to be mandatory. You don't have the choice. to not get vaccinated and work.
Mm-hmm.
You are now going to be forced to be vaccinated. And so I took my last vaccination was May. My second one was around May 23rd of this year. So 8 months from now, they're recommending, and I'm sure that'll become a forced thing too, a booster. Some people feel like, okay, this is great, but some of this is also interfering with the rights we have, or this isn't even FDA approved yet. So why are we having to do all this? On top of that, we still have to get a flu shot. And COVID is very real. I mean, I saw COVID. I worked on the COVID units. Most of the people, as I shared, were elderly white people, mostly Black people, and brown people.
Mm-hmm.
And it was scary. And what I noticed from my visit in Atlanta when I visited, I can actually say, and I told people this when I came back, I said, I probably was more leery when I visited Nashville than I was when I visited Atlanta. I can actually say the folks when I visited Atlanta this month, I thought were similar to the people in Chicago, wearing masks, trying to still social distance, respecting whatever. But then when I went to Nashville, I was like, oh my God, I'm definitely in a red state.
Yeah. Yeah.
I'm going down Broadway and I'm like, okay, there's only so many people wearing a mask. And then if you are wearing a mask, they're kind of looking at you like, what do you have a mask on for?
Right.
It was very, very interesting.
Well, there are some places in Atlanta where I think you could feel like you're in Nashville. Because sometimes I'm like,
I'm sure.
excuse me, where's your mask? And I'm from Kansas, and I've been with my mom back and forth for the past few months, and it's just interesting to go into the store and you're standing by someone and they don't have on a mask, and the whole store is almost like that. So I certainly understand what it is you're talking about there with Nashville. I want to take a step back because I think that this episode is quite unique and special in that we haven't had a chance to really fully talk to someone in healthcare who's offered direct service, someone who has a sense of what's going on, and to kind of do a look back and maybe even look forward in terms of what next and how to best protect oneself. And also the question about what is it that we can do to provide the best assistance and support for folks in healthcare who are dealing with COVID. But let's kind of look back and talk about, at the inception of all of this, what your initial thoughts were about, where we would be going into or heading into with this COVID-19.
Oh my gosh. For me, I still, if I'm going to describe it, I felt like we were living in the twilight zone. I could not believe, because I never thought in all my time I would live during a pandemic.
Mm-hmm.
I never, I'm 59 and I'm thinking, no, that's not possible. And 2020 just seemed to be like something many of us in healthcare, we just don't want to. It's kind of like, I don't want to remember that time. It was too scary, too leery, too unimaginable. The isolation and when I would talk to my peers, some of them, being separated from their partners, their family, certain work became very rigid. Every day you were being bombarded with emails. The CDC says this. The hospital CEO says this. And it was just like, oh my God, seriously? What kind of world are we getting ready to live in and go through? And then to take care of the patients that we had to take care of became even more real. And then some of my coworkers got sick, so you watch coworkers get sick that either they were compromised already, with asthma, certain other health issues, and then they got sick, or they were around family members that were sick and they got sick. It was just a lot. It was, I don't think we were pre-COVID, when it hit. I don't know if we were really prepared.
Mm-hmm.
I think we're still going through the flow of like every day, like, okay, we're going to do this, do that. I think we're still learning, which is scary, but it is what it is.
Was there ever a time in the midst of all of that when you thought, well, maybe this is a good time to quit and get a new job?
No, you know what? I never felt like that, but there were coworkers who, I remember one of my coworkers, she could have probably stayed at work a couple more years and retired, but she was caring for a mother who was in her 90s. And my coworker said, I'm out of here, and then some of them, once things started really getting bad, with COVID, it got even worse. They were like, that's it. I'm out of here. I'm not doing this. I'm not going to put my life at risk. And some of the older individuals at work, they decided to opt out and not take care of patients anymore and just like do the pre-check-ins at the door. It's like, no, I got health issues myself, but I still want to stay at work, but I'll just check you in at the door to make, and ask the questions and still have a job, but I'm not going to work on the floor anymore unless I'm forced to. So, yeah, but I never thought, I want to quit because of COVID or I want to retire early. I always say I want to retire early because I'm tired, and it's like I'm counting like, okay, come on, hurry up, 62, hurry up, because I can't go to 67, because so many things have changed, and technology plays a big part in it. Hospitals have gotten to be so corporate that it just doesn't seem like that homey atmosphere when I started. Even in a bigger hospital, we were still like family. And now it's just so rigid and everything is so structured and so strict, so political. And it's just like, okay, are we missing something here? I miss that time back in, when I started in healthcare years ago, like say 30 something years ago, when it was much more family, even in a bigger institution. And it's not that way anymore, which is kind of sad.
What are some specific changes that, and I know you alluded to this earlier in our conversation, some specific changes in healthcare that you've seen based upon the COVID-19 pandemic?
Oh, the changes. Well, I'm sure that the whole mask mandate, that's probably going to be for a while. It may be with us forever. We don't know. And in Chicago, the mayor just instituted again that it's going to be a mask mandate starting the end of August, that when you go into some space that's public, you'll have to have a mask on. I mean, and in Chicago, there's places you can go and they'll say, okay, if you're vaccinated, you don't have to wear a mask. That's your choice. But if you're unvaccinated, you do have to wear a mask. Well, we don't know who's vaccinated and who's not.
Right.
But then there are things that are coming up that in Chicago that they're actually asking when you go to certain bars or certain concerts. You actually have to show your vaccination card. to get in, or you have to do certain things prior to being able to go to that event. And I just think for now, with this whole COVID and Delta variant going on, those are going to be things we're just going to have to live with for some time.
It really seems surreal because I recognize that I'm not someone who needs surgery. I'm just someone who needs to go to the dentist. But I made some very real choices, and I'm really thinking about what does it mean to be afraid of just going to the dentist now, based upon what we're dealing with when you're totally open and exposed, with your mouth. It is like we're living in a twilight zone, and these are surreal times, and times where I think we really have to the best of our ability, form community and fight things that isolate us in a world where we're already unable to touch each other.
Yeah, I agree.
And that leads me to this question of the merging of your two vocations, healthcare and ministry, and thinking about how the church has been so fundamental in the ways in which issues of public health and some issues of social justice have really been thrust throughout the community. And, fighting the COVID-19 pandemic is not different from that, using the places of faith as ways of getting out information, encouraging people to get vaccinated and wear the mask and things like that. Knowing your role as a respiratory therapist and your role as a minister, how do you best speak to where we are now and the role that some of these places of faith can help support the fight against COVID and our attempt to really create community in the midst of something that's quite isolating?
Well, I know for a lot of churches here in Chicago, even predominantly Black churches, they chose to take on Zoom video for church when COVID was really bad, and to issue, like, hey, it's important to get vaccinated. It's important to social distance. But I do think, and I think we had that conversation briefly when I was visiting you and with my friend that was with me, church is going to be a very different challenge, places of worship in the future. COVID has really made us have to look at what is church going to be like in the future. First of all, you have a lot of millennials, not to stereotype, that don't go to church or a place of worship, but they may be very spiritual. And this whole thing with COVID has just kind of said, okay, we're going to have to look at how are we going to really define and do church and places of worship? Because it may just become virtual, or it may just become something else, but how are we really going to make that happen and still have community in the midst of the COVID time? How are we going to do that? And I have coworkers that say they still, oh no, I still don't physically go to church. I strictly do online, because I'm still kind of leery.
Mm-hmm.
So I guess a question would be also, how are places of worship going to survive with that change? If we do have to change and go strictly Zoom or let's say Meets, Microsoft Team Meets. I don't know. It's a big thing to think about.
Are you still at Trinity?
Oh no, I haven't been to Trinity in years, and actually haven't. really not at a place right now.
Mm-hmm.
You know, I watch things online, but physically I have not gone into anywhere in quite some time.
That begs the question, in this time with COVID, is there any, I guess, desire for you to find spiritual community, or are you just content with what you've been able to do, or are you just too busy with work?
um, I'm okay with. I mean, like, do I miss physically being in the place of worship? Yes and no. You know, it's kind of like, no, I'm okay if I listen to something online or watch, and I feel like I have the community around me that is spiritual enough. You know, I don't know. It's a good question, and I think work also has a lot to do with it for me. You know, I work night shift, going at 7 o'clock at night, get off at 7:30. And trust me, I have tried to do early morning service, and I'm sitting up front falling asleep, and it's just not working. Or I'm trying to come home and then go to the later service at 6 o'clock, you know, in the evening. So yeah, that has a lot to do with it. Also, my working schedule. Yeah.
Maybe what you've just talked about is another indication of how the church has, and I'm being very specific about how Black churches, because that's the community which so many of us are part of or are associated with, even though if you're not a member of a church, you know something about the church. You know?
That's right. That's right.
And how it seems like our lives have changed so much, the schedule, the rhythm, the pace, the things that influence it. But the church hasn't done a good job of keeping up with that or making that transformative leap as well. So I think you're absolutely right in our talking about, well, what does the church look like in the future? Is it still going to be relevant? And some people would even question, is it relevant now in the midst of this twilight zone of this pandemic, where you see some churches that are very actively against vaccinations and mask wearing and think that it's an act of faith in order to, you know, God's gonna keep you. God's got you. Jesus got you. You know, you don't need that vaccine when you got Jesus.
Yeah, until you get sick.
Until you get sick. Right.
Right.
So there's so many things I think that are changing. Time is filled with swift transitions. You know, I mean, so many things are changing in our world today with the COVID, and it almost seems like that we are really being set up for a new way of being human in the world. And I won't go into some deep conspiracy theory about that, but it just really is, when we're moving to these virtual spaces and really away from the ability to be physically in touch with each other, that the whole pace of life, the rhythm, the way in which we move and understand each other and what it means to be human is shifting as well.
Yeah, I agree. And I for me, Angela, I think that was the big part. And I know somebody asked me the other day at work, they said, what if we were to go on lockdown again? And I said, oh, hell no. I can't do that again for another year and something. I said, I was already isolated, you know, in so many ways. You know, I had to isolate and come home. There were family members I couldn't go visit, friends because they were older, or just, you know, they were like, oh, no, I don't want visitors, or my partner doesn't want visitors. And, you know, because they have a certain health issue. So it just, for me, it was like, it was too much after a while. I was just like, oh my God. Like when I did my recent visit, I was like, oh my God, I can actually go and visit people, and I feel like I'm living again. But for that time being on lockdown, it was just, I was like, oh no, this is too much. Because all I'm doing is going to work, and I'm actually living and seeing what I watch on news 24/7. And then I've got to come home and isolate, you know, and go to the grocery store and be leery about, who's standing next to me, or just be all freaked out about things. I don't know. I can't do that. Like, I'm more of a social person. I'm more of like, let me be around you. Like, I'm not necessarily the virtual kind of, I'm trying to get used to the whole FaceTime and Zoom. But I do kind of feel like you just said, we're going in an era and time where we're just really losing that whole human touch. And to me, it's really kind of sad. And then some people, they like it. They're like, hey, I'm an introvert, so it's good with me.
So what did you do for self-care? I mean, how did you make sure that you gave yourself what you needed in order to show up each day to work and to life?
Oh my God. Prayer, meditation. I listen to music, danced around my space, turn the music on, went for walks in the neighborhood. And it was just really interesting. Like, there were other people with the same, they would be out in the neighborhood, walking their dogs or just walking, to get out, and we'd all mask and we'd respect the social distancing. But it was really kind of sad because in my complex, there are a lot of children, and I was used to seeing the kids out, and how they draw on the sidewalk, the little chalk, and they're playing. It was like the kids became invisible. And it was really kind of sad because you kind of wonder, like, what has happened to their lives. Like, you read about stories like in the New York or the Atlantic, and they call them COVID kids, but it's kind of like, I felt really bad. And I remember a couple of young kids, when they finally did reappear, I said, where have you all been? And they said, mom and dad kept us inside, because of everything going on. So that's why you didn't see us anymore. So they're slowly letting us come out,
This is a question I posed earlier. Just how can we best support folks in healthcare who are really in the hot seat of caring for folks with COVID, who are, daily have a very real face of what the COVID-19 and this Delta variant is. How can we best support you all? I mean, what can we do?
I think just by talking to us, reminding us that we do have community, whether that community be outside of our family, our friends. And then there's that spiritual component, because that became even bigger. The spiritual component, and then the mental health component of having that help as a healthcare provider. And then some of us didn't talk about it, and others did, how the whole thing was like, I'm going stir crazy. And many of us had to go to therapy, really rely on our spirituality even more. And if you were used to being a person that physically went to that, then that changed for you. So the hospital that I worked, they really did try to provide that support, like to make sure, if you needed somebody to talk to, whether it be a chaplain, or if you needed the outside support for mental health, they tried to really guide you to take that, to not go alone and try to deal with taking care of these patients every day, not just COVID patients, but patients in general.
Right.
And then your mental and spiritual health is being impacted. And for me, if I didn't have community and some family members during that time, even though we couldn't physically see each other, I would have probably lost it even more, you know, because again, it felt very isolated during that time, very lonely. And I just felt like, okay, this is not healthy. All I'm doing is coming home from work. Then I have to isolate. I can't really be around anybody because of the patients I'm taking care of. And then I have to protect myself. I'm like, I can't. So that's why I said I can't do this again if we were to go on lockdown. I'm just like, oh no, I'm going to go really stir crazy, you know. And then when I talk to friends of mine who are therapists and physicians, they just really think COVID just sort of exacerbated. Like if you already had issues, you know, and then somebody said to me last night at work, they said, oh, I think Chicago's violence has increased because, you know, people are just going nuts now. They were locked down for so long. They just like, they're just out like, okay, let me go and do this because I can now. I'm free and I'm going to do this. And if it means committing violence or whatever, that's what I'm going to do. You know, and it's like, some people feel like, well, let me use that as an excuse, the whole lockdown as an excuse. I don't know. I mean, it's pretty scary in Chicago right now. And I'm like, what is going on? People are just going crazy.
You almost want to ask yourself, certainly with the history of violence in Chicago, can you all take any more?
Oh my gosh. Whew. I don't think we really can take any more. I mean, I had a coworker who she's a nurse who was riding the train one night home. Now she doesn't ride the train because she's afraid. And what happened was there was a homeless man on the train. He had a knife and he catcalled her and she didn't take to his advantages. So he told her, he said, well, I guess I'll just kill you then. Pulled out a knife and, you know, she was freaked out. She has not rode the train since. And that's probably been 2 months ago.
Wow.
You know, and here, you know, she's coming into work to take care of people. She's trying to get to work to take care of people. And then somebody tries to attack her. It's just, it's really, it's really some scary times. And then to say, you know, when I read things online and they're like, oh, the mayor is instituting a mask mandate. You know, why in the hell isn't she taking care of the violence here in Chicago? And, oh, they're hyping the numbers up and that's not true. And I'm like, oh my God, here we go. You know, you just kind of wonder, like, let me just walk out my door, get to work safely or get to the store and get back.
Well, based on what we've talked about and just the reality of where we are, as you look forward the next few months into fall and winter, what would you speculate where we're heading into? Or is it even possible to make some speculations of what we may be heading into?
Well, some of us are thinking that the flu season is not going to be great this year. It may be even worse with COVID and the Delta variant. And I don't know. I mean, that could be based on the region where you live, how people practice, whatever, if they've been vaccinated. And even if they haven't been vaccinated, are they practicing, you know, all the things that they need to do to be safe and keep others safe? We really don't know what's going to happen. It's like we're going day by day. You know, just sort of going through the motions of like, okay, this is what's going to happen. This is what we're being told by the CDC. This is what the president of the hospital says. This is what we do.
I feel like it's a perfect time to interject some wisdom by Samuel Proctor. And this whole idea of preaching as celebration, and you never end on the note where you can't celebrate. And I feel like we've been through some very deep valleys in this conversation, particularly as it deals with COVID. We need to end on a celebration.
Yes,
There
we
needs to
do.
be a shouting moment. What's the good news? What's the gospel? What's the thing that you celebrate at the end of this conversation? How do we institute the celebration of life for people so that in the midst of all of that we're dealing with, we're not left in a place where we can't find hope and joy and compassion and celebration?
Well, I know for me, my celebration, I can't speak for others, but I hope, is just being outdoors in the crowd of people, enjoying, like today, it's beautiful in Chicago. That's my celebration. As well as, yes, I was recently able to take a trip. So for me, those things I celebrate, and when I came back, I was like, oh my God, I'm on a high. I took a trip and I did this and I did that. That's my celebration. That's what gives me life. And even if it's walking in a neighborhood, talking to somebody, a smile, or as I'm reminded every day, just take one day at a time, and look for the good. Because in the midst of all the bad, there is good out there. And we have to remember that. There is some good.
Sherri Jackson, I think that'll preach. In the midst of everything that's bad, there is some good. And my joy today, my celebration is that we've had a chance to be in conversation with you, because when the folks look back on this period of time, on this history and herstory, I want them to know that we were present and accounted for. And I just wish you all the joy you can handle, and rest and love and peace and joy as you walk into your place of work, and that you will always find that celebration in your heart and your life, and you'll continue to be a light for so many other people. Thank you for the work you do. And Sherri Jackson, thank you for being part of our Black Lesbian Herstory.
Thank you, Angela, for inviting me. I appreciate it.
Sherri Jackson, thank you for leaving us with a great celebration. We may not know what the days ahead will bring, but have we ever? It's important in the midst of such uncertainty to find your celebration. And if your celebration is like Sherri's, by getting out and enjoying the outdoors, and put that on your to-do list a little more often. May you find the things in life that bring you joy to be at your front steps each day, so that you can get out and make a difference in the world in which you live. Well, whatever your celebration is, I want to just stop and say kudos to you and thank you for spending some time with us today, listening to the Zammy Nobla podcast. We so appreciate your listenership. And until next time, have a sweet one.